Good evening, ladies and gentlemen. My name is Dr. Ede Edupolo Usazua, a consultant obstetrician and gynecology, the Chief Medical Director of Grachelle Hospital and Fertility Clinic. People, because I take care of women for a living, people call me Minister of Women Affairs. This is Grachelle Multispeciality Laboratory, a state-of-the-art laboratory that can carry out all the tests that will be universally acceptable all over the world. Here is my scientist Chukuma, who is the chief scientist of this Grachelle Multispeciality Hospital. She's here to take you around the laboratory and tell you what we do. Scientist, well done.
Good evening, everyone. My name is Scientist Chukuma Anna, the Chief Med Lab Scientist of Grachelle Hospital and Fertility Center. I am here to take you around our lab. Here we have the ion selective electrode, and is used to test for electrolytes. And electrolytes includes the potassium, the calcium, the chloride, the sodium, and the bicarbonate. Then here we have the semi-automated for clinical chemistry tests, and it has to do with the LFT when you want to check for LFT, that's liver function tests. And the parameters here include the AST, the ALP, the ALT, direct and total bilirubin. Then also we test for GGT, then serum albumin and total protein. Here also we can also test for, with this machine, we can also test for lipid profiles, and the lipid profile parameters, they include the triglyceride, the cholesterol, LDL, HDL. Then also you can also use this machine to test for urea and creatinine. Then here we have the chemiluminescence for testing for hormonal profiles, and hormonal profiles includes the follicle stimulating hormone, the LH, the prolactin. LH is luteinizing hormone, then prolactin, estradiol, progesterone, testosterone, AMH, thyroid stimulating hormones, which is the TSH, then hepatitis B DNA, then HbA1c. Then also we test for beta HCG. Then this is the microscope. Microscope is used for viewing of wet preparations and also stain slides using the emulsion oil. Then here we have the 5 parts hematology analyzer. This 5 parts hematology analyzer brings out all the differentials. There's no need for mixed. It brings us all the differentials, and the differentials include the monocytes, the eosinophils, the basophils, the lymphocytes, and the neutrophils. Then here we have the electrophoresis machine, the digital electrophoresis machine, which is used for checking of genotype, if it's AS, if it's AA, or if it's SS. Then here we have the centrifuge. Centrifuge is used for centrifuging samples, and samples include the blood samples, CSF, then also urine samples. Thank you.
There's a common saying that prevention is better than cure. And I also add that it's better for you to go to the hospital than to carry you to the hospital. In order to avoid any form of complication in life, it's better for you to come for your test. Check your blood pressure. They will now run your samples. Now run your test, which will do your lipid profile, will do your blood glucose, will do your kidney function test, your liver function test, and prostate test. I want you guys to come, let us run the test so that if there's anything wrong with it, you can easily address it. And I will repeat again, as a consultant of obstetrician and gynecology, the men are working so hard, the men are trying to survive, looking for money everywhere, in order to prevent you from becoming for your wife to become a widow. Come over and do your test so that we can identify if you are at risk of having stroke, or if there is a risk of kidney abnormality, or if there is a risk of brain abnormality. Come over and run your annual test, and at the end of the day, if there's any problem, we'll address it accordingly. Thank you very much for viewing our page. If you have any question you want to ask us, you can only make comment and suggestion on our page. Your suggestion is highly welcome, and at the end of the day, as the Bible will always say, with long life will He satisfy us and show us the salvation. That will be our portion this 2026